to the press briefing. On stage, we have Dr. Edward Choi, Controller for CHP, Dr. Albert Au, Principal M&H Officer from Department of Health, Dr. Libby Lee, Director of Hospital Authority, and Dr. Sarah Ho, Chief Manager from HA. Dr. Choi. Good afternoon, everyone. I'd like to give you the trend of cases in the past week. The CHP have been receiving about 30 to 50,000 confirmed cases per day. And we haven't seen a twofold increase every 2 to 3 days with very strict social distancing measures. Now, looking at data from Octopus, apart from those who have to leave home to work and for daily needs, we see that members of the public are staying home most of the time to contain the infection or epidemic. And the government has been adopting the policy of early identification and early treatment and early isolation. Now, to ensure that positive cases can be isolated as soon as possible, our testing strategy is through PLC to confirm positive cases. And we've also got a very widespread use of RAT kits, and the positive results from RAT kits are quite reliable. So the government announced that starting from the 26th of February, members of the public may be using their own RAT kits or those distributed by the government. And if the results are positive, it would be regarded as a positive case. And members of the public with such results are advised to stay home to lower the spread of the disease. We understand that RAT kits have been widely used by members of the public to test themselves and to undergo self-isolation and recuperation. To give us a better idea of what the trend is and to provide appropriate support for high-risk patients. Today, on the 7th of March, the government is going to launch the reporting hot platform for positive results from RAT kits so that related persons can report their positive results to the platform. It will be launched at 6 p.m. today, and the website is www.chp.gov/HK/RATP, and the website will be included in our press release later. After the platform is launched, those who were tested positive before on the day of the launch of the platform, you can make use of this platform. In other words, if you were tested positive on the 6th of March, then you can report your results on the 7th of March. The tests can be done on the day or the day before reporting. We encourage people with positive results to report to us so that CHP can follow up as soon as possible. And then a hospital authority will call high-risk patients to provide medical support and triaging. Those reporting will have to provide the following details: the personal particulars and information of their household contacts and their personal symptoms and also the home environment. If you make a report, you should prepare a photo of your RAT kit result. And you'll be asked about the conditions of your household contacts, whether they need to go to an isolation facility and whether your home is crowded to facilitate triage by the government. Usually, for those who are positive because of their home environment or needs, they will be given priority to go to community isolation facilities so that they won't have to stay in undesirable living conditions affecting their own health and that of their family members. Some reported cases will be arranged to take PCR tests for verification. Our contractors will arrive at the address of the reported case on the reporting day or the next to do a swab. After successful reporting to the platform, the person concerned will receive an SMS by their mobile phone, and the person will have to use the link contained there to upload information, including picture of a positive RAT test and also ID. Once this is successful, then CHP will provide a link to issue an isolation order. The CHP will also take follow-up action based on information provided by the person, including medical support or whether a person should be admitted to the hospital or a community treatment facility. Based on information provided by the person, CHP will issue an SMS to household contacts. Hyperlinks will be provided for uploading of their ID. When it's successful, then through the link, household contacts can then download an isolation order issued by CHP. Now, for isolation and quarantine arrangement of person with positive RAT, it will be on a par with those through an PCR. Now, if you are under isolation or quarantine, you have received 2 jabs of vaccines, then on the 6th and the 7th day of your infection, you can do an RAT. For those with 2 doses of vaccination, and if you stay home for isolation, then again on the 6th and the 7th day of infection, you can do an RAT. If you have 2 negative results in a row, then you can leave home or CIF on the 7th day, and the quarantine or isolation is over. An electronic wristband and an information kit will be distributed to those who have made a report. We expect that initially the traffic will be quite busy, and it may take longer for such items to be distributed to you. And we hope that members of the public can use our thematic website and also a 24-hour line 1-833-019 under Stay Home Safe to obtain the relevant information. We understand that starting from an announcement the 26th of February, some members of the public might have already been tested positive throughout AT and have been staying home for isolation. And therefore, there is a special arrangement under the system for those between the 26th of February and the 5th of March. For those tested positive by RAT, and within 7 days after the launch of the platform, that is by the 14th of March, they can give us information of their result, and they'll be given an isolation order. Since it's been a while since they were tested positive by RAT, we believe their conditions should be rather stable here. Some of them might have already recovered and have obtained 2 negative results in a row. So we will not carry out individual medical follow-up for this group of people, but we encourage them to report to us proactively so that we have a better grasp of the trend of the epidemic in Hong Kong. If need be, you can make use of our hotline and receive medical support at our designated clinics. We advise members of the public. We believe many people will be using our platform. So for those who have obtained a positive result in between the 26th of February and the 5th of March, you don't need to rush to report now. You can do it by the 14th of March.
Conversely, if they get the positive result in the past couple of days, they can make the declaration either today or tomorrow. We advise that the members of the public can make the report through the platform and upload the relevant information. If people don't quite understand how to use the platform, we do have another hotline, which is an auto system, 1-833-6119, 1-833-6119. This will enable people to register their ID and phone number. The CHP will be contacting the relevant citizens via this hotline. Since this is handled manually, this will take a longer time than if the information is uploaded online. So I urge people to take full advantage of the platform online to make the report and file the information. I also like to urge the members of the public that this platform is intended to cater for those who test positive using RAT, for those who test positive at the government recognized lab. If they get a PCR positive and if they have already received SMS to this effect, they should use the SMS link under that system to file the information. Before and after the PCR test, even if they have the positive RAT, they don't have to file using this system because we do have their own information. For those RAT positive, they can start reporting online. For those who are waiting hospitalization or isolation, we will give support. We have updated our thematic website and provide more information about the information about the care and how to monitor their health, like personal hygiene, household hygiene, and disinfection, and all the rest of the advice. On the web, we also have the helpline and the services available. And for those who have been double vaccinated, the condition for completing the isolation, and we do have the information available for people to get to grips with all the relevant information. With the new platform becoming available, we can support those testing RAT positive, and we can achieve the purpose of early identification, early isolation, and all the epidemiological follow-up. We expect that this system will minimize all the hassle involved in obtaining the quarantine and isolation orders. And with our concerted efforts and with the support of the mainland, I'm sure that we will be able to triumph over this wave of COVID. Now, for those senior citizens who are unvaccinated, in order to minimize critical cases and serious outcomes, I will urge them to get the jab. I'm going to defer to my colleague to take you through all the procedures. The HA will have the tiered system to take care of the patients to minimize some serious cases and deaths. And we will reserve the services to the serious cases. For other COVID positive cases, they will receive isolation and services in the community. It is our purpose to identify the cases early, those mild cases that are likely to deteriorate, and these are high-risk groups. They are elderly people over 70, children under 5, and pregnant women of 28-week pregnancy, and those who are immunocompromised, like those who have organ transplants, and those who suffer from immunocompromised conditions, or those who are taking medicine which compromise their immunity. If they have mild symptoms, we would strongly advise them to seek medical attention. These patients can seek medical attention through 3 channels. They can make an appointment at the 17 designated clinics. In the designated clinics, if their conditions permit, the doctors would prescribe some oral agent for COVID to them. We have 17 designated clinics providing about 3,000 consultations per day. We would pay particular attention to these high-risk people and increase the quota where necessary. Second, the PPSC, we will identify the high-risk patients, and we will ring them up and provide them some health advice. Where necessary, we will arrange for the patients to be treated at the relevant venue. Third, they can also call the 1-836-115 they can receive a remote consultation. We have 100 lines available for the needy to make inquiries. For the care homes, those test COVID positive, we have outreach team, or we have the telemedicine. Where conditions permit, the doctors will also prescribe the oral agent for COVID to them. For more serious cases, they will be transferred to hospitals direct. The community geriatric assessment team will not only care for the COVID patients, they also look after the non-COVID patients, in particular those who have mobility problem, who find it difficult to turn up at the SOPC for treatment. For the mild cases or asymptomatic cases, we urge them to remain calm and pay attention to their state of health. They should pay attention to personal and environmental hygiene and take all the anti-pandemic measures. If serious conditions occur, they should turn up at the A&E hospital, A&E ward. Like after taking paracetamol, they still feverish, more than 38.5 degrees for 2 days, or their temperature is lower than 35 degrees. If they have seizures, shortness of breath, dizziness or confusion, if they're frail and unsteady in their gaits, if the fetus activities have become less, and if they suffer from diarrhea and difficulty, and no appetite and so on, we advise them to turn up at the A&E. Other than the declaration system mentioned by Dr. Choi, the HA will also roll out an isolation and observation system. For those who have tested positive, they will receive an SMS where there is a link for the confirmed patients to register. After registration, they can report their serious symptoms, and we have all the health advice for them. There is an information platform, and they can leave their information, and we will call them back, or we will arrange for a teleconsultation for them. Also, we will remind and provide some channels for these COVID positive patients on the 6th, 7th, and 14th day to report to us their RAT result. And the results will be announced shortly. Finally, I'd like to make 2 pleas. First, we hope that our fellow practitioners in the private market to join us in the consultation team to provide support to the patients. Second, for those who are using our clinics, in the past, we have so many patients coming to the clinic for the sick note on the 25th of February under the Gazette. The Employment Amendment Ordinance Amendment Bill 2022 has been gazetted, and if people cannot turn up for work because of all the COVID measures, they can apply for sick leave, and if they can also for those who test positive, they can enjoy the sick pay, so they don't have to turn up at the clinic for the sick note.
Dr. Out will update on the number of cases. Fellow citizens, friends from the media, I'd like to report to you the number of confirmed COVID cases. Yesterday we confirmed 25,150 cases, 471624 to 496773. Among the 20,000 cases, 1,980 cases were confirmed by HA, 2,440 by Public Health Laboratory. The remaining 20,726 by private labs. Among these cases, 32 were imported. The remaining 25,118 cases were local cases. Among the imported cases, at least 25 cases were from Indonesia. On GA876, they arrived at Hong Kong on the 6th of March, and the cases were detected then, involving 24 females and 1 male. because of the numerous cases from this flight. Under the Control and Prevention of Infectious Disease Ordinance, the Department of Health has required Garuda Airlines to suspend their flights from Jakarta, Indonesia, from the 8th of March to 21st. As of now, in the fifth wave, we have a total of 48,436 confirmed cases. As regards genome analysis, the Public Health Laboratory analyzed 2,444 cases, and no case was found positive to L452R. 1,690 cases were negative to L452R, meaning that they were Omicron cases, and for the remaining 754 cases, they were either pending or insufficient viral load. As for cases from care homes, we had another 18 care homes yesterday with outbreak or cases. 11 care homes were for the elderly, 7 for persons with disabilities. 112 cases were involved, 69 being residents and 43 staff members. As of now, for elderly care homes, 673 elderly homes have been affected, accounting for 84.8% of all the homes in Hong Kong. A total of 14,700 residents were affected, and about 4,000 staff members of RCHEs were infected. For homes for persons with disabilities, so far 220 care homes have been affected, accounting for 65.7% of the RCHDs in Hong Kong. 4,350 residents and 1,605 staff members were affected respectively. Now, for the number of deaths so far in the fifth wave, 2,074 deaths, and up 280 compared with yesterday, accounting for 0.43% of the total number of cases. Age range from 11 months old to 108. The median age is still 85 years old. Now, for the Public Health Laboratory, has conducted genome sequencing of some of the cases. It has completed 140 cases. Among the 140 samples, 13 were positive to L452R, accounting for 9.29% of the total samples, meaning that they were Delta cases. 117 samples were negative to L452R, accounting for 83.6%, meaning that they were Omicron cases. We've got 10 samples where the viral load is insufficient. CHB has analyzed these latest deaths. Among these cases, 94.8% of them affected the elderly at 65 or above. Those who are over 80 or above, they accounted for 68.5%. For death rate, those 70 to 78 is as high as 1.13%. For those over 80, the fatality rate is 7.39%. So we analyzed whether these cases were vaccinated or not. Among all the deaths, 90.6% of them were not either not vaccinated or fully vaccinated. For those over 80 years old, 93.1% of them, of the death cases, were not vaccinated or not fully vaccinated. So for those who have got 2 jabs of vaccines, how do they compare with those who were not vaccinated or not fully vaccinated? How did they differ in terms of death rate? For those who have received 2 doses or above of vaccine, the death rate is 0.05%. For those who are not vaccinated or not fully vaccinated, The death rate is as high as 1.4% at 8-time difference. This is very obvious among the elderly. For those 80 or above, those who have received 2 doses of vaccine, the death rate is just 1.86%. For those unvaccinated or not fully vaccinated and over 80 years old, the death rate is as high as 9.949%, a 5 times difference. And Dr. Ho, please. Thank you. 8,010 confirmed or preliminary positive cases are receiving treatment at public hospitals, North Lantau Highland, North Lantau Hospital, and also hospitals infection control center, and also Asia World Expo Treatment Center. There are 2,300 patients under quarantine at Penny's Bay Quarantine Center. We reported 75 cases in critical conditions, 106 patients in serious condition, 68 critical patients are receiving treatment in ICU. As at 00 hours today, in the past 24 hours, a total of 161 COVID positive patients passed away. 106 male, 55 female, age range 29 to 102 years old. For patients who passed away yesterday, 96 came from care homes. 126 had no record of vaccination. Only 21 had received 1 jab, and 13 2 doses, and 1 3 doses. 147 were 65 years old. Among those who died, there are few younger patients. There is a 29-year-old female who was suffering from cancer and who has metastasized. And another 36-year-old female with thyroid and endocrine disorder for more than 10 years, and she has been receiving medical follow-up. Her condition, she was unwell for a few days, loss of appetite. On the 5th of March in the evening, she collapsed. Our ambulance on arrival found that she had no heartbeat. Our first aiders use cardiopulmonary resuscitation, and at the A&E department, she was arranged to the ICU. Unfortunately, even after resuscitation, she has passed away, and the coroner court will conduct an inquest. We have a 45-year-old man who need renal dialysis. That is, he is chronically ill. Another is a 49-year-old female who unfortunately had cancer and had metastasis. And then we have also got figures aged 56 to 60. Either they had either chronic illnesses or cancer.
About 2 boys who passed away. An 8-year-old girl, she suffered from a thyroid condition on March 6th. She had a fever and some headaches. She sought medical attention at a private practitioner. Our AT test came back positive, and she was prescribed some drugs, and she went home at 7-ish. This morning, her condition deteriorated and she became unconscious, and the family resuscitated her at 7:30. She was taken to Queen Mary Hospital by ambulance. On the ambulance, there was CPR resuscitation, but this morning at 8:28, she passed away. The case has been referred to the coroner's court on February 29th, and she had the first dose of vaccination. The second girl, a 4-year-old girl, she had congenital heart conditions, And because of poor response and vomiting at 2 a.m., this morning she was taken to the A&E at Queen Mary Hospital, and she had no heartbeat at the time. She was given CPR resuscitation, and her heartbeat was recovered, and the PCR test came back positive. The hospital transferred her to the ICU at SETI at 8 this morning. Her heartbeat stopped, and after CPR resuscitation at 9:35, she passed away. And on February 24th, she had the first dose of vaccination. Now, for these two cases, they would be counting towards the number for deceased tomorrow. Because of a time lag, today we will be reporting 119 deceased, 76 males and 43 female, ranging in age between 50 and 101. And we have 388 patients who have recovered and discharged, and 38 patients were picked up during admission screening to be positive, and 44 patients in the same ward are listed as close contacts. For staff members, we have 9,463 COVID positive, 1,529 have returned to their posts. And there is one report I'd like to make. The HA would like to thank the Lee Kashing Foundation for donating $10 million for private hospitals to take patients, COVID patients, and the private hospitals are the Chin Wan and Stubbs Road Adventist hospitals. We have identified 450 suitable patients, and we are getting in touch with the private hospitals for them to be transferred. And there are some coronary heart disease patients, receiving the colorectal problems, and there are some emergency cases that have been referred. In QE Hospital, we have referred some newborns to the St. Teresa Hospital for treatment. We've also at Queen Mary Hospital, for those who need regular transfusion, we have transferred them to the Gleneagle Hospital to free up some of the daytime wards for the more serious COVID patients. So much I have to say by way of a report. It's now time for questions. Please wait for the mic and identify your organization and make it brief when you take the floor. Lady over there, please.
I'm from Bloomberg News. I want to ask about the funding from the Lee Kashing Foundation. Does that mean that the foundation has basically donated $20 million now to go towards paying costs to transfer these patients to private hospitals? And are there any costs that are also being paid by the government to transfer patients from public to private hospitals? And my second question is about reports on that police will be helping with carrying out the compulsory universal testing campaign. Has there been any confirmation of how many police officers will be helping with this campaign, and whether it's mostly police from basically the riot police division? And my last question is about the 8-year-old and the 4-year-old girls who have died. I realize their deaths are probably going to be investigated by the coroner, but so far, are there any indications that the main cause of death is from COVID or it's from the underlying conditions that were mentioned? Thank you.
Okay, thanks very much. Could I clarify with you about the second question? Is that on the compulsory universal testing, the manpower, you mean? Okay, thanks. So I'll leave the question one on the donations, and the third questions on the 80-year-old the child case to Dr. Ho to respond, and later I'll respond to the compulsory universal testing issues. Thanks. Dr. Ho, please.
Concerning the Lee Kashing Foundation, in total, Mr. Lee donated 60 million Hong Kong dollars to this special project. In general, the funding, the foundation will cover the charges of the patients spent in private hospital, except those self-financing items. For example, those who need to have pericardial intervention or standing, the stand in itself is a self-finance item. So the patient need to cover that part. And for the two kids, one is 8 years old and another 4 years old. Both of them have underlying medical chronic disease, underlying medical conditions, and we also find them COVID positive. But the exact causes, whether it's due to COVID or died of COVID, we need to refer the coroners for further investigation. Thank you.
So for the compulsory universal testing program, it is a major operations that the different departments and bureaus are still making plans and preparing for these major operations, and it will mobilize many different resources and manpower from different departments and bureaus, including retirees to come back to work. So since it is still under the preparation stage, so I will leave the other government department and bureaus to respond to you and to update you about the progress and the actual implementation details later on.
One more English question, please.
Good afternoon from SCMP News. Regarding the private hospitals, may I ask what is the total number of beds that private hospitals have given to take in public hospitals non-COVID patients so far? And also regarding the deaths for the children, is there any coroner update on the other kids who had passed away previously, such as the 11-month-old kid and the previous other death cases? And also regarding for the new RAT platform, are there any other functions besides allowing people to report their RAT positive cases? How will the platform also coordinate with the other COVID hotlines, such as the one launched by the FSD earlier? And those who tested positive before February 26 through the RAT test, can they still upload their results on the platform? And also, do you expect a huge increase in case numbers over the next few days in the platform because of the newly reported test results? Thank you.
Okay, thank you. So maybe I'll leave Dr. Ho to respond to the public-private partnerships about the hospital bed, and also some details about the investigations of the previous fatal case of children, and then I'll respond to the RAT. I'll respond to the RAT platform issues. Dr. Ho, please.
At the moment, there are around 12 beds from Hong Kong Baptist hospitals, and mainly is for rehab patients. And also we have around 20 beds from St. Paul's Hospital, and also CU Medical Center. We also have 24 beds for COVID patients. And for other hospitals, we are still liaising for further collaborations. And for the coroners, we are still pending further update from them.
For the new rapid antigen test platform, which it will be launched later today at 6 p.m. today. So the purpose of this platform, there are several purposes. One, because the rapid antigen test is quite a popular and easy to use test in Hong Kong, and it gives a relatively sensitive result. So it is a very good tool to be employed at home for an early detection and early isolation to help the government and also the public to curb the spread of disease in the community. So the second purpose is to assist the departments to get a more comprehensive and more updated information of the current disease situation in Hong Kong. So the platform will also help to expedite the support, both medically and also other social and also support to the confinees, who stayed at home. And it will also provide to facilitate. We issued some supporting documents like the isolation order and also the quarantine orders to those in need when they stay at home, because we received quite a number of inquiries about to receive some documentations when they are staying at home for isolation or quarantines. So the whole platform, which helped to first the public health measures and to also provide a means for us to provide more medical and social support to those confinees, and also for documentation purposes for those who need any documents. So we expect there will be a surge of reports from today, because after we announced the initiatives of recognizing the RAT as a laboratory testing result on the 26th of February, we noted that there are many people are now waiting for this platform. So we appeal to members of the public that this platform will open at 6 p.m. today, and those which is for day back reporting, which is from 26th of February to the 5th of March, we will allow a 1 week period of reporting this day back information. So there's no urge to report those old cases or old information to us today. But indeed, for those who had the positive RAT result today, we hope people of the public can report it today or tomorrow. So we have to observe the search, a number of search today afterwards, and to maybe we'll work with our IT colleagues to further streamline and update the whole process. So there is a fire services department's new WhatsApp and text and email information, which is a very good channels or means to help us to locate those who required or who want to have to go to the isolation facilities. So there will be two channels. One is from our regular channels that we receive the reportings, either from the PCR test or the new RAT platform. We receive information from the applicants or publics to let us know if there are any difficulties who stay at home, which they want to have, they want to go to the isolation facilities. But on the other hand, if they want to let us know earlier so that a more prompt referral can be made, we appreciate the fire service department to give this new means of a WhatsApp and text number so that people can contact our fire service departments earlier to arrange the transferal. So this is quite a complementary measures and tools on top of our RAT platform.
下一位，嗰邊最後嗰行最中間嗰位男士，係最。
Next. Good afternoon, TVB. For the reporting platform for RAT positive to be launched soon, have you tested how much it can cope with, how many cases it can cope with? And for the hotline, I'd like to know what is the manpower deployed to answer inquiries and also the registration procedures. The HA or the CHP, I'd like to know whether they're going to deploy more resources to help elderly or very young confirmed cases. I'd like to know why your community isolation facilities are only 40% full. Is it because you have hiccups in placing people to CIP, and the FSD is responsible for receiving information. Would there be duplication of workload? Now, the mainland expert, Ms. Liang Wanian, said that dynamic zero infection policy is for early detection and early isolation. Does that mean there is some kind of coexistence with the virus? First, I'd like to respond to the question about the new platform to be launched at 6 p.m. today. We've discussed with relevant IT staff. We spent some time in designing the platform. As you said, we have to be careful about the traffic flow and circulation and the operation. And there is also preparation. We need information report to us, and we have to cross-check with information we already have, because if those cases are already known to us, we may not necessarily open a new case because of it's being reported to us. Because in the fifth wave, it's quite likely that a person will be reinfected a few weeks after recovery. So these cases will be screened out. And if the case is not yet known to us, then it's considered a new positive case confirmed by RAT. So we need to cross-check between two systems, and technically some procedures have to be done. From the 26th of February to now, we expect that there are a large number of cases out there waiting to report to us. They've been waiting for the platform to be launched. So may I appeal to those RAT positive in between the 26th of February to the 5th of March. You don't have to be so eager to report them to us. At 6 p.m. today, we allow you 1 week to report those cases. So we will have to keep an eye on the cases we have to deal with, the traffic, and also cross-checking of information. Some arrangements have to be made. After 6 p.m., we'll be able to see from data reported to us, and we may need technical adjustment. For instance, the bandwidth and also the speed we process these cases. And I'll defer to Dr. Ho on the isolation facilities before I take questions about the elderly and young patients and FSD. The hospital authority has got medical stations at CIF to provide medical support to people living in CIF. As regards management operation of CIF, they are coordinated by the Security Bureau. HA, as a member of the team, will cooperate with the Security Bureau and provide appropriate arrangement for those admitted to CIF. Now, this question about our strategy in infection control. As Dr. Au said, we've got over 48,000 cases in the fifth wave. Analyzing these cases, now the groups of people affected and age groups, they are quite widespread. Now, for those in between 20 to 59, they account for over 60% of the total number of cases. But then, younger persons affected display milder symptoms, perhaps because Omicron is a milder variant, and secondly, the vaccination rate in this age group is quite high, and so symptoms displayed are not so serious. But for those over 60 to 79, they account for close to 20% of the total number of cases, and for those over 80, 4 cases. 4%. Although the percentage of persons affected in these age groups is lower, but then they are more serious because of the lower vaccination rate among these groups, and some of them have chronic diseases, and so that's why.
Our policy is in relation to senior citizens, not least those in care homes, and not least those who are unvaccinated. We give priority to them. We hope that in the coming weeks we will be able to scale up the vaccination for senior citizens in care homes. Like Dr. Al said, we see outbreaks in care homes on a daily basis. If we can do something to protect the uninfected senior citizens who are unvaccinated, if we can ramp up the vaccination, I'm sure that it will go some way towards bringing the pandemic under control, in particular the among the senior population. So we have to do more for the elderly population. All along, as you all know, we do have voluntary medics who are helping with vaccination for the elderly. The HA and the DH together have formed the vaccination teams during this the height of the pandemic, and we will be able to ramp up the vaccination in the care homes. Second, the children. We saw a number of serious cases, fatal cases, but in general, children who are infected do not suffer very serious symptoms. There may be some odd cases because of their underlying condition. They may be more serious, but the vaccination coverage is low among the children. Now, for children vaccination, at the very beginning, some parents adopted a wait-and-see attitude. When deciding on taking their children for vaccination. Now, for the 3-year-old group and above, I think we have to speed up the vaccination. The experts have given us a lot of comments in terms of the anti-pandemic policies and strategies. We have to control the transmission. If we cannot control the transmission, the high-risk groups, elderly children, they will be on the receiving end of the impacts. We do have stringent social distancing measures. If we have a lot of people flow, it would be hard for us to keep on top of the transmission. If we have positive cases, we have to make sure that they are cut off from any contact with the community. If we have the isolation measures effective enough, we can snap the chain of transmission. There are some household settings in which the patient need family members' care, and in these cases, we have to make sure the transmission will be cut to a minimum. So we have to make sure that transmission will be minimized. You asked a question about the reporting platform, whether there is an overlapping with the Fire Services Department's hotline. In this platform, basically, it is consistent with the reporting under the PCR system, like the personal condition, the occupation, the workplace address, residential address, the family members' condition. We would ask about the household settings, whether they are living in places where they have to share the facilities like toilets, or whether they have to share the use of kitchens, or they need to tell us whether there are any family members that give rise to concerns like people who have poor immunity. Then we would triage the patients to identify those with the isolation facilities. Now, for the FSD system, they have the WhatsApp and email platform. This is really an eminently good measure to cater for those who are awaiting arrangements, and at least they let us know their needs. When we make arrangement for the positive patients to the isolation facilities, the fire services department's colleagues would make arrangement for them to go into an isolation facilities like hotels and others. When we receive the information on the platform, we will pass on the information to the relevant colleagues for follow-up. If patients would like to make things happen faster, we have another platform for them. The lady at the far end, please. Phoenix TV. At the moment, the death rate is pretty high, and we have 100 or so fatal cases every day, and 90% of them are unvaccinated. Dr. Al has already explained the situation. How do we actually ramp up the vaccination in Hong Kong? And how can we scale up the vaccination? The chief executive said within 2 weeks' time, the vaccination for the care homes should be completed. How much progress have you achieved vis-a-vis the care homes? Do you think we should make it mandatory for the senior citizens or the whole of Hong Kong to be vaccinated? Why can I answer in Cantonese? Thank you. In terms of vaccination, in the past 2 weeks, we have been seeking to ramp up the vaccination. Your observation is correct. Looking at the COVID now, the most serious places are places where the senior citizens are unvaccinated, and not least the senior folks in care homes. Now, when there is a transmission, the elderly people are on the sharp end. Now we see the situation. We have mobilized several different teams, and they at the early stage, there is a matching with the care homes, but the speed wasn't fast enough, and we do have voluntary teams joining the vaccination program. The HA and the DH have also formed the vaccination outreach teams. We hope in the fortnight's time we should be able to scale up the vaccination for the care homes. We can streamline the procedures. Previously, we needed the consent of the senior citizens and also the family members. I hope that the family members would understand that we have the best interest of the residents in mind. That I think we can administer the injection in absence of any consent from the family members if the senior citizens consent, because the benefits outweigh the disadvantages. We know that in terms of vaccination, if the uninfected elderly citizens were to get the infection, to get the vaccination, will stand them in good stead. As to the intervals of the injections, there were some discussions with the scientific committee. The intervals between the second and the third can be shortened so that they can complete the 3 doses within a certain period of time. As all these measures will help, we have to look at the manpower and the arrangements, and we make sure that the vaccination will be completed in the coming 2 weeks in the elderly homes.
I'm AM 730 regarding the platform. I'd like to know whether the type or the brand of our ticket has to be reported, and I'd like to know the percentage of random sampling for PCR. And you said you can click take whether there is a need to go to a CIF if the reporting person has said no. Is there any possibility that he will still be admitted to a CIF? Because if that's compulsory, then people may worry for their livelihood and choose not to report. And I'd like to know whether you have any progress when it comes to more private hospitals accepting COVID patients. Now, if after a rapid test, a person does a PCR test, should it wait for result of the PCR or still report based on his RCT result? I'd like to know for this wave, do we have patients or recovered patients being reinfected? All right, designated hospitals. Doctor will talk about whether we have seen patients reinfected after recovery. The platform is for people to report RAT positive results. So the person has to key in his ID number, or his name, his address, whether he has symptoms and information of household contacts. After that, we will send him an SMS. The link, he will use the link to upload 2 items of information. First, the picture is showing his RAT result. We do not require the brand of the RAT kit to be displayed because we believe Hong Kong citizens are law-abiding, and then we'll require him to upload his ID to us. Now, there is a legal liability in making a report because once you have reported a positive result, we will issue quarantine order or isolation order for you and your household contacts. So if the information is false or if you deliberately make a false reporting, then there is legal liability involved. So we very much hope that members of the public can give us true information. And we will verify the information reported to us. And after that, an isolation order and a quarantine order will be issued to the person and his family contacts respectively. Dr. Ho, the epidemic is still raging. And our public hospital has been very proactively increasing the number of isolation beds to cope with the surge and demand for hospitalization. We have provided community treatment as well as isolation facilities. We have activated Tier 2 beds, and North Island Hospital and Two Moon Hospital have been converted to designated hospitals for COVID. And to cope with more patients to come, HA has retrofitted very strong ventilation fans in general wards to enhance the rate of air exchange, and such measures will greatly increase the number of beds available for COVID patients. Hopefully, we'll be able to admit more COVID patients to relieve the pressure on public hospitals. We're now overseeing the works and also risk assessment. We will also look at the training and PPE and infection control of our staff. We'll do it bit by bit, and we will announce new developments to the public. The reporter asked, what if a person does a PCR test after an RAT test? Now, if there is an RCT positive result and when waiting at home and RCT is done, then there is no need to report the letter to us. On the other hand, if there is already an RAT positive, then we hope that the case can be reported to us so that we know it is a case, and we can provide medical and social support. And a case has to be reported for documentation. for the benefit of his employer. Because if he stays home and then if he's vaccinated and after two negative results at the 6th and 7th day, then he can leave home and return to work. If he's unvaccinated on the 13th and 14th day, we give him documentation for the sake of his employer. Now, if RAT positive, this is sufficient proof for documentation. So we don't encourage him to do another PCR. Even if he is not required to submit the results to us, because we already know that this is a case, because if it is an PCR positive case, we already know it. So there's no need to report to us through the platform again. So if a person knows that he is RAT positive, then in terms of infection control, he should stay home to lower the risk of transmission. So if he can report RAT positive to us, then we can give him documentation. He can then be eligible for sick leave. I hope this will alleviate the burden on the community, and the platform will give us more information of the epidemic, because I think majority of the community is using RATs. This is voluntary test. So I hope members of the public can do it on a voluntary basis and submit the information to us. Dr. Au. Now we have mainly the Omicron variant, which started in November last year globally. This variant, so antigens is quite different from previous variants. So scientifically, it is confirmed that for those who were COVID positive under different variants may or can contract Omicron again. So for those who were infected in 2020 and 21, some of them have been infected this time. So now BA.2 started to appear in Hong Kong in mid-January. So many of the cases, some of the cases are a second infection, but we don't have statistics here. When we have if we receive cases that were previously infected, then it would be regarded as a case of reinfection. Cable, Dr. Lee. You talked about oral medication to be dispensed at designated clinics. I'd like to know when can you start such prescription, and what is the stock you have in hand, and what is the criteria for prescribing such drugs. I'd like to know the number of private doctors participating in this scheme. In Kashing Estate, there are 6 blocks. 5 blocks have been subject to RTN. So is there a major outbreak in the housing estate? Could have come from a Tak Long estate in the vicinity? Dr. Hao will talk about the situation in Kashing Estate, and Dr. Lee or Dr. Ho can talk about the oral medication and telemedicine. Kashing Estate, we had positive samples under the sewage surveillance program with rather high viral load. So last night there was RTN, and quite a number of cases were identified. Some blocks had over 15% in the number of positive cases. That shows that in certain blocks of the building in particular, there's been a major outbreak. So in the past week, this is the government's position. If in RTN positive cases are found, the cases will be removed from the buildings and sent to CIF for isolation.
in Hong Kong, the COVID situation is pretty serious. It would be hard for us to trace the origin. So the most important thing is to conduct the sewage surveillance to identify the hotspots and carry out an RTD to pick up all the relevant cases and for them to be isolated. Dr. Lee? Thank you. The oral agent will become available in mid-March at the designated clinics. Of course, the experts are discussing under what circumstances the drug would be prescribed and whether there are any side effects that we can bring you up to date later on. As to the medicine consultation, we have, this is the doctors are selected from the locum office. We have 110 doctors and 239 nurses, and in fact, there are 33 of them that are actually involved. The lady over there, please. Ming Pao Daily. The number of confirmed cases has come down. Have we hit the peak? Is it really on the way down now? Now, what about the specimen collection numbers in the community centers, or is it because of people coming in fewer numbers? And the reporting platform, how many people can you accommodate at one time? If people, let's say, I test RAT positive and do not make the report, do I have to get tested again? For those who test positive after March 6, if they haven't got the picture of what's going to happen, if they use test kits and not recognized by the government, what's going to happen? And also for the HA, the 4-year-old girl who passed away, has she been subject to any PCR test? This 4-year-old girl and 8-year-old girl who passed away, what sort of jabs did they receive? Did the family members test positive? Have they turned up at the designated clinics, or have they ever called the ambulance because of the overcrowding at the hospital that they cannot be admitted? Starting from today, the HA has announced some ICU information. Is it an update? And there is a child under 3 who's in ICU. What is the latest situation? Can you bring us up to date on the children's critical cases, and also the one who received the 3 jabs? Right, let me address the number of cases first, and also the RAT reporting platform, and I defer to the HA about the hospital situation. Over the past 2 days, the numbers hovered around 30,000. Compared with the earlier days, it seems that they're not as high as 50,000, upwards of 50,000 earlier. I think an actual situation would depend on the rolling out of the reporting platform. Some have used the RAT instead of the PCR test. So they are waiting for the platform to make the report. So we have to look at the statistics going forward. It seems that just from the PCR test statistics, we do not see a multiplication in 3 to 4 days' time. There are 2 sets of information that we cannot know for the time being. For those who conducted RAT and test positive on the 5th and 6th of March, how many people are there? And that would make a difference to the overall statistics. And earlier, from 26th of March to 5th of March, 26th of February and 5th of March, I'm sure that most of the members of the public do keep a picture of the RAT test result, because they do have to show the result to the companies. most of them would have the picture. I hope that they will pass on the picture to us. If they do, there may be some who don't have the picture. We will deal with them in a special way. They need to upload the picture. Now, for these old cases, there can be a declaration that they make to the effect that they have chucked the test kit, and we will deal with them in an exceptional way. Now, these are exceptional arrangements, and we allow them to report to us the result going back a week or so ago. Going forward, when people make the online application, they have to make it a point that they keep a picture of the test results. So going forward, we will not allow any situation where there is an absence of the test result picture, but this is an exceptional arrangement this time. Actually, I know that you would like to find out more about the statistics on the confirmed patients. In the past couple of days, we started making available the ICU statistics. We have 388 children who are in hospital. They are 0 to 11 years of age. Now, for the two children, the 4-year-old, she had one shot of Sinovac at Queen Mary Hospital on Feb 19th, and the other child, the 4-year-old one, I don't have the information with me for the time being. You also asked about the 3-year-old. I don't have the information either for the time being. Speaker not speaking through. Speaker not speaking through. Okay. Beg your pardon, I missed the question. Statistically, we have the IT colleagues doing the backup work. When we set up the platform for transmission, now if we have more than 60,000, we would experience some congestion. Now, after that experience, we would, let's say, if there are 100,000 people coming in, we would be triaging the patients. As to how many people are going to be coming forward, it would be hard for us to make any speculation. For old cases, they don't have to rush and make the report straight away. For new cases, the cases dated March 6th or 7th, if they make the report today, we should be able to cope in our capacity. Let's say we can cope with 30, 50,000. I mean, we can even cope with 100,000 if we have an upsurge of cases. Then we can lengthen the waiting time, and people can still log in, although they will have to wait a little bit longer time. We cannot anticipate how many people are going to be coming in at any one time. Any more questions? Speaker not coming through. All right. In the entire system, if people test positive using our AT, they should stay at home and do not go away. And they should let us know so that we do have the statistics. On the web, we do have a lot of information on the high quality kits. There are some rapid antigen test kits that have been tested. There are some that are verified in mainland in Europe or in the US. You might wish to look at the information there. Now, for kids that are not on the list, if you test positive, just file them nonetheless. Now, we can conduct a PCR confirmation. The idea is to let us know about the cases and carry out the control measures.
呢個檢測
Well, the RAT test is entirely voluntary, so I very much hope that members of the public can report their RAT positive results to us. Some may feel that there is no need to be tested and they can go on their lives normally, but we hope they can be mindful of their health, and if there is any problem, they should seek medical consultation. I'm from Now TV. In the community, there are recovered patients who receive PCR positive results after they have been RAT negative and they have received isolation order. So what should these people do? And as for the RAT reporting platform, they have to report first and receive an SMS, and they have to upload a picture. And so when can the whole process be completed? When can they expect to receive the information kit and supplies? Do you have enough manpower to handle such a large volume of reporting? And for the 29-year-old who passed away, was he vaccinated at all? 3 questions. I will ask Dr. Au to help. I'll talk about the platform, and Dr. Ho will take a 3rd question. We have 2 steps. First, reporting. It is by means of a form to provide us with information. It's not going to take long. We need to know personal particulars of his household contacts, including the names and ID number, so we can issue quarantine orders to them. After submission, our system can instantaneously do the electronic comparison. It's not done manually. So if it's found to be a new case, it has never appeared in the 5th wave, then it will become a confirmed case. So we will issue an SMS to the person concerned for submission of ID and also a picture showing the RAT positive kit. It depends on how soon the person can respond. Once information is uploaded, an isolation order can be issued at once, because the isolation order is already ready. We are just waiting for information from the person who reported the case. So if the process is smooth, then it is done electronically. No manual handling is required. For some special cases, such as incomplete information or is found to be an old case, the handling will be a bit different. If it is a known case, then we will send him an SMS to tell him that the case is not accepted, and we will have an email address for them to contact us. And we will check how come we have already got a record and then there's another RAT positive result. For family contacts, the procedures are very much the same. After submission of the ID, when the person who has reported his RAT positive result, and the family contacts will receive an SMS at around the same time as the person concerned receives an SMS. So an ID copy will be needed, and at once we can issue them with a quarantine order. Provision of supplies. We expect a large number of cases in these 2 days, because many people have been waiting for launch of the platform. So after reporting, we'll take time to send out things such as RAT kits, things to note for staying at home. And because of the large volume of cases, the waiting time may be a little bit longer. But information is readily available. Before receiving the information kit and other supplies, you can go to our thematic website to note things to note if you stay home to isolate. You have to receive an RAT kit, but because you have got an RAT positive result, probably you have already got RAT kits at home, but you may need more, and such kits will be sent to you as soon as possible. We are thinking of the fastest way to send out such kits given the sheer number of cases, together with government departments and organizations. Dr. Au, so the case you referred to now, that is an RAT positive result followed by a PCR result and then an isolation order. Because I don't have details of the case or information of the case, it's hard for me to comment. Generally speaking, in a private lab or in a public laboratory lab, once a positive result is obtained, it will be reported to the CHP. When we have the report, of course, we would know the name and identity and perhaps even the telephone number of the person. We'll use his name and ID number to check whether it is already a confirmed case in our system. If the answer is yes, then this is the second sample from the same patient. We will not regard the second sample as a new case, except in very exceptional circumstances, such as a reinfection. If the interval between the two positive samples, is very short, and if both have been reported to us, then we know that it is an old case. We will not assign a new case number. We will not issue another isolation order. If a person is confirmed and he does an PCR test, then he will receive an SMS telling him that he is positive. Now, if it is a recent test, he will be given a link to report his information to the Department of Health. That will happen, but then if in our system we know that this person with the same ID is a previous case, then we will not assign a new number and issue another isolation order. But then if he is a family contact of a confirmed case, then he may be given an isolation order. And if from household contact he becomes if he is a household contact, he will be given a quarantine order. But if he subsequently is confirmed, then he'll receive an isolation order. For the case you mentioned, because I don't have information, I can't comment whether there is some mistake in any way. The speaker is not coming through. The speaker is not coming through. The speaker is not coming through. So this person is originally a confirmed case. So on the 6th and the 7th days, he has negative results for 2 days in a row. So he can leave home. But then he goes to a testing center for PCR test, and he is positive. Then in this case, he must receive an SMS afterwards, because the testing station will know that he has had 2 negative results in a RAT. So Department of Health will receive notification because it is report from the laboratory. And so we will cross-check. How come this person has a positive PCR test, can it be a false positive? We will have to investigate. Or could it be that the negative RAT results were inaccurate? We'll have to investigate. Now, if it's confirmed that he is still infectious, then we may isolate him once again because he's still infectious. Now, for a confirmed case with 2 jabs of vaccines on the 6th and the 7th day, it's quite likely that he will have negative results. If not, after 2 more days, the results will be negative. If it's always positive, shouldn't have left home at all. He should wait until the 14th day before he can leave home.
好講啦。
Dr. Ho? Yes, if I may supplement about the Ming Pao question, the 2 children have received Sinovac jabs. And the other question was about a 29-year-old female, and there was no injection of any kind for COVID. That's it for today. Thank you all very much.